Most people are unaware if they have or had a sexually transmitted disease, specifically chlamydia, for reasons I will discuss later on. However, today we will discuss first the history of chlamydia, next the symptoms, then treatment and prevention. Much of the information I'm going to share with you today came from the National STD curriculum. To understand this disease, we must understand where it came from. In 1907, scientist Prozac took conjunctival scrapings from patients and infected the eyes of orangutans to discover the spreading of the disease. Later, in 1936, they deemed it to be a virus. Chlamydia is the most common reportable bacterial sexually transmitted infection in the United States, with approximately 1.7 million cases reported annually. This is from 2017. However, infections are usually asymptomatic, which means there's no symptoms, and it is estimated that 2.9 million infections occur annually in the US. Chlamydia is unfortunate yet interesting because of the complexities of the virus. For example, it can be transmitted through any sexual activity, even without ejaculation. It can also be transmitted through birth from mother to newborn, infecting the eyes, which causes pink eye or conjunctivitis. You may be wondering why it targets the eyes so much. It is because it is a mucosal membrane, which is also why it feeds into the groin area. Earlier, when I said most people don't know if they have chlamydia, it is because it is asymptomatic. Remember that word? According to Med Broadcast, about 80% of women and 50% of men won't show signs of symptoms. However, that is not 100%, so women may experience lower abdominal cramping and men can experience testicular tenderness. They can also both experience a burning sensation while urinating and abnormal discharge. Now, moving on to treatment. You should see your doctor and figure out which drug would best suit you, considering the symptoms of the drug and the effects it will have on you. The most important form of treatment is prevention. Of course, abstinence would be the highest form of prevention, but we're human. Other alternatives include condoms to avoid douching and lowering your amount of sexual partners. I say prevention is the most important because once you are treated, you need to stay abstinent for about a week and avoid having any sexual contact with any others to avoid reinfection. Another important thing to consider is having annual checkups or regular screenings. Ideally, you should have these every 6 months to 1 year, as infections can appear within 1 month. In conclusion, chlamydia often goes unnoticed, but you are now aware of the history of chlamydia, the symptoms, and treatment and prevention. Health is the most important thing you will ever have in life. Take care of yourself and others. Thank you.